the West African nation of Sierra Leone now, where there is an unprecedented nationwide lockdown underway tonight. The government is trying to control the spread of the deadly Ebola virus. As many as 6 million people have been confined to their homes. Health officials are going door to door, handing out bars of soap. They're also on the lookout for symptoms. Over 2,600 people have died from Ebola. At least 5,300 others have been infected. And as Jackson Prosco reports, if the disease goes unchecked, it could have widespread international repercussions.
As the sick lay dying in the streets, the international fight against Ebola has focused largely on containing the outbreak, support for medical staff, new clinics for the growing number of infected.
This is not just a health crisis. It has grave humanitarian, economic, and social consequences that could spread far beyond unaffected countries.
Now the UN and many experts warn the threat isn't just from the virus, but also from something just as dangerous: fear.
That fear is translating into problems in governance, such as rioting, into military quarantines undertaken by those governments to control the spread of the epidemic, and it's translating into economic destabilization for that region as well.
Travel bans have crippled local economies and slashed incomes. Supplies aren't getting in or out. So worried are international officials, there are predictions of an economic catastrophe in the hardest hit countries, Liberia, Guinea, and Sierra Leone.
These countries break down, if their economies break down, if people panic, that has profound effects on all of us, even if we are not directly contracting the disease.
The World Bank believes that as the virus continues to surge, so too could the economic impact. Fragile West African countries could lose up to $800 million as sparse economic growth is reversed. Canada learned the high cost of an epidemic during the 2003 SARS outbreak. The economy lost an estimated $1.5 billion, mostly through reduced travel and tourism. In Africa, the risk isn't just lost productivity, but political instability as prices rise and supplies become scarce.
A lot of these governments have not necessarily used the aid they've had for trying to build their health organizations as well as they should have, and some of their citizens are dissatisfied with that. They would rather have seen a much better response from their own governments.
The international response to Ebola will have to consider economics as well as health care, as the virus weakens more than just those who have fallen ill. Jackson Prosco, Global News, Washington.